So this was my highest med-surg grade, and I'm gonna tell you how I did that. I just came from the gym, so I look a mess, but like, let's just get straight into it. My tip number 1 is going to be these 4 resources: Simple Nursing, Nexus Nursing, Nurse Sarah, and the Level Up RN. Those you can dang near replace your book with. They're amazing. What I did was, when I knew the topics that I was going to have to learn in class, I would take notes on them first through those websites or those apps or whatever, and I would come into class with those notes, and whenever my teacher was talking about or lecturing on, I just added on to it. Class, you should be learning nothing new in class. Everything should be a review, and obviously if you have a good teacher, they'll give you some tips and tricks, and just jot those down on the side. I did it with a different color pen too. So I took my notes in black ink, and when I would go into class, I would add little extra notes with red, so I know that those were the notes and stuff that I got from my teacher, like the supplemental information. Those are going to help you so much. Be prepared and go to class knowing a little bit of information off of them alone. Those 4 resources are going to help you. So my number 2, which honestly should be my number 1, is pathophysiology. Girls, guys, if you do not know how that body function, that body system is working correctly, it's going to be so hard to identify when it's not working or when something is wrong, especially when you're studying like adverse reactions to medications or transplants specifically, because a symptom or a sign of a transplant not working is what that organ looks like when it's failing. How do you know if it's failing if you don't know how it works in the first place? For example, the heart. When I was studying the heart and I needed to know like cardiomyopathy, endocarditis, tetralogy flow, when you get into mom and baby, you gotta know how the heart works. So I was studying how the blood flow through the heart, the functions of the heart, the electrical conduction system, everything about the heart, because that made taking my exam so easy. I'm like, oh, well, it's supposed to do this, and that is not a symptom of it working correctly. So I was easily able to like do process of elimination. So that is going to be your best friend. Learn how the body works. A&P is your best friend, and we all forget about it when we're on our prereqs and it comes to bite us in the, when it's time to study. So the heart, the kidneys, the lungs, learn how it works in the first place. I'm telling you, that is going to save your life during exams, and it helps you not memorize. You're not going to be able to memorize in nursing school. I don't want to put that on you. Maybe you can. Maybe you're great. That wasn't for me. Memorizing was not my strong suit. So I needed to know how it worked in and out, and it made test taking so much easier. Practice questions and active recall. Those are going to be really good when you're studying too. After you've gotten the material down a little bit, do some practice questions. Write down those rationales. Even the ones you get right, write them down. And if you heard this before, that means it's true. I did it. It really worked for me. I didn't do practice questions until I knew the information a little bit, because you